Good day, Miss. Today I will be demonstrating to you one-handed technique. One-handed technique is a very good technique, especially for clients or those patients who have limitations of motions, muscle weakness, and stroke patients. It is very helpful for them to become functional and independent in their ADLs, especially on dressing. So I will be showing to you three demonstrations. First is using one-hand technique in dressing on or putting on a shirt. Second is buttoning a shirt. Third is putting on or wearing lower garments. So first is wearing a t-shirt. In one-handed technique, wearing a t-shirt, as I have said, stroke patients, they have hemiplegic side. If the right side of the brain is affected, the contralateral side is affected. Therefore, it could be flaccid or spastic muscles. But in later onset, most patients have spastic muscles. So it will be very difficult for them to use both arms on dressing. So usually the unaffected arm is more likely to move than the affected arm. So for the rules of dressing, you always dress first the affected arm or the affected part. So now I will be demonstrating to you, assuming that I have a right CVA. So my hemiplegic side is the left side. Okay? So the first thing that you have to do is make sure that the client is in a good position. No barriers at the back so that he or she wouldn't have a hard time putting on the t-shirt, especially when you put it over the head, then pulling it down. So next is you get the shirt. So this shirt is a loose shirt. It's easier to wear loose shirts than than fitting shirts. Okay, you place it on your lap. Then make sure you are you are seeing the back of the shirt. Then you check the tag there. It's here, so this one is the back of the shirt. And it is also important that you're seeing at the back of the shirt for t-shirts, so that when you pull it or when you put it on, it won't get interchanged. So you won't be wearing it in reverse. Next is you put it up towards the whole of the left sleeve. For here, place it here, there. Then you lift the affected limb, then place it inside the hole, then you lean forward and you lift the sleeve and past elbow here. And after that, you now put your unaffected limb on the right hole sleeve, then you pull it up to the other side, then you use this one. I will just remove my glasses. Then put it over your head. Then you now try to pull down the shirt. Pull it down. There. So this is how you you just arrange it. So this is how you successfully wear a t-shirt using one hand. So this is very helpful because it will the patient would become independent in dressing regardless of his or her condition. Now next is I will be demonstrating to you the bottoming of t-shirt. So I have here a big polo. Again, for this one, it is designed for patients who have hemiplegic sides or stroke patients or those patients that have limitations of motion. Yes. So, bottoming and dressing is almost the same, except that the in dressing a t-shirt, when you look at your lap, you are seeing at the back of the shirt. But in bottoming a t-shirt or in a polo, it's the opposite. You are actually seeing the front of it. So now I will be showing it to you. So again, this is still the hemiplegic side. Then you get the polo. There. Place it like this. The front of the polo must be the one that you are seeing. So it's unbuttoned already. This one. So the thing that you do is you start first on the left sleeve. So it's like you bring again your hemiplegic side on the hole, just like the same on the t-shirt. There. Then you lean forward. Right there. Then you just pull it up again. The next is you locate the tip of the other side of the collar. Then you it over the back. Then this is now the time you insert your unaffected limb on the next sleeve. So there you are. Then you arrange the sleeves. As you arrange the sleeves, you just move it here. Arrange the sleeves. Then now, another important tip that you should know is when buttoning a shirt, you should always start from the bottom, because tendencies are if you start from the top button, then you won't be able to, sometimes your bottoning is wrong, then there's an extra, or you were not able to find its pair, so you start at the bottom. Now I'll be showing it to you. Actually, the buttons of this polo shirt is quite small, so it's really challenging, but it takes a lot of patience for you to wear it. Here, okay, I had the first button. Then second one. Then third button. Still trying to place it. Third button and fourth one. I know it's not yet the last one. Yes, it is. It is. Here you go. There. There you go. You got it right. Then we're finished. Okay, next. Next one is wearing a lower garment. So in wearing a lower garment, this is also important, one-handed technique in wearing a lower garment, because some muscles in the muscles of the hemiplegic side or spastic muscles are there in hemiplegic side. So there is a problem in the flexor muscles of that side. So it would be difficult or more challenging for a patient to dress their lower garments. So they cannot just easily, flex their legs and wear it like how we can normally wear it. So now I will be showing to you how to properly dress lower garments with one-handed technique. So first again, position your patient and you lift the hemiplegic leg like this. It's like in a number 4 position. Then you get the lower garment. Then you place, again, you always dress first the affected leg. Then you place it in on the left hole of the pants. Then you lift it but not beyond the knees. There. Then you put it back down. Then now you start to put in your unaffected limb on the right hole, or like the sleeve of the pants. Then you stand. Then pull it up. There. So that's it. We had it right. That's how you wear a lower garment using one-handed technique. So thank you.